Hello, my name's Dr. Wayne Rosenkrantz. I am a board certified veterinary dermatologist and I practice with the animal dermatology clinics. So my topic for the Hills Symposium is canine atopic dermatitis. How do you use the newest drugs in clinical practice? And we need to understand that canine atopic dermatitis is really a complex disease. I'm going to discuss why these drugs have increased the success and the management of this disorder, and how, as a specialist and you as a practitioner, would use these in clinical practice. So I would like to have you watch my lecture. You can see the lecture live stream on April 20th or on demand at the Hills website, which is hillsglobalsymposium.com. So I think it's going to be a great event, and I hope to see you all there. Well, there's probably been very memorable moments in the exam room. One in particular that I think about, and it still makes me laugh to this day, is a client who brought in a dog that was highly suspicious for sarcoptic mange or scabies. In fact, the dog was intensely pruritic on the floor before I even did an exam. I could see heavy crusting on the margins of the dog's ear, so I was very suspicious about scabies. The owner was even kind of scratching a little bit as well. So I was inputting my information in the computer and not really looking at the client. And of course, one of our questions that we always ask during our dermatologic exam is, does anybody in the house have any itchy skin disease? And this gentleman said yes. And before I could even look up, his pants were on the floor around his ankles, and he had his backside facing me, and there was quite an alarming papular rash on his bottom side. So I don't know if that would be saying anything, but it was more of an action that certainly resulted in a little bit of humor. And it is always funny how clients feel so comfortable with their veterinarians that they sort of assume that we're the same as their own human physician. Well, since I'm going to be talking about the two current drugs that we, use to manage canine atopic dermatitis, the biggest takeaway is for me to emphasize the efficacy and the safety of these new drugs, which is very, very high. And I'll share my personal experiences as well as evidence that's in the literature to support this. The other point that I want to take away is that there are some modifications in how we use these drugs as specialists. And although some of the things I'm going to talk about may be off-label, it's important for practitioners to know that there are some modifications that not only myself, but other specialists have utilized in increasing the efficacy of these drugs. The last thing would be to sort of show maybe some case examples toward the end of my lecture where I'll talk about specific instances where maybe one drug would be preferred over the other. As a referral dermatologist, I have the opportunity, I've seen, thousands and thousands of cases over the years. And so I work with all different levels of referring veterinarians in our area. And I think veterinarians, as a rule, do a really wonderful job in treating the clinical presenting problem. The dog is itching, we're going to stop the itch. The dog has an infection, we're going to treat the infection, whether it's the skin or the ears. I think where veterinarians, as a rule, can improve their dermatology skills and reduce some of the frustration that they may see themselves and their clients may perceive is discussing and priming clients for workup for the primary underlying disease. So it's very important to understand that infections and pruritus are just not typically a primary problem. There's always an underlying disease that lurks underneath that. And so it's important to have discussions, even on first-time presentations, to have that conversation with the clients about the need to do, dietary trials, further allergy workup, more diagnostics on why an infection may come about. And then you're going to have less frustration and you're going to have more success in your dermatology cases.